लाइफ में लेना देना तो चलता रहता है। इधर फ्लेक्सी लोन से बोरो कर लिया और उधर बाय मॉम डैड का वेकेशन डन। शादी का डिसीजन लिया, फ्लेक्सी लोन से और बोरो किया। प्रमोशन मिला तो ये लो थोड़ा लोन वापस कर दिया, थैंक यू। नए इंटीरियर्स का डील किया, फ्लेक्सी लोन से फिर थोड़ा ले लिया। ईयर एंड बोनस मिला तो इस बार लोन ज्यादा वापस कर दिया। लाइफ में लेना देना चलता रहेगा तो लोन्स में क्यों नहीं। इसीलिए फ्लेक्सी लोन फ्रॉम बजाज फिनसर्व एक ऐसा लोन जो जब चाहे बोरो करे, जैसे चाहे रीपे करे, वो भी चुटकी में। थिंक इट डन विद बजाज फिनसर्व।
हेलो, हर सीजन के लिए नए इंटीरियर्स?
हाँ, वो भी हर रूम के लिए।
फ्रिज, स्मार्टफोन या बड़ा टीवी?
तीनों क्यों नहीं?
अरे ये तो शॉपिंग लिस्ट में नहीं था।
सो अब शॉपिंग कार्ट में तो है। सॉरी।
अच्छा, नए आउटफिट्स की विश लिस्ट।
विश क्यों? Just add to cart and buy.
तो ये सब EMI पे?
और वो भी चुटकी में। On India's fastest growing EMI network. Think it done with Bajaj Finserv.
सर, अपनों को खुश रखना इससे आसान हो ही नहीं सकता। साहब, अपनों को खुश रखना इससे आसान हो ही नहीं सकता। हुजूर, अपनों को खुश रखना इससे आसान हो ही नहीं सकता।
अपनों को खुश रखना इससे आसान।
अपनों को खुशियां दिलाना आसान नहीं बनाते तो आगे कैसे बढ़ते। इसीलिए हम जो भी करते हैं उसे बेहतर बनाते आ रहे हैं, बनाते रहेंगे। बजाज फिनसर्व, थिंक इट डन।
माँ के बेडरूम का एसी या लेटेस्ट मोबाइल फॉर भाई, लेटेस्ट मोबाइल फॉर भाई, लेटेस्ट मोबाइल फॉर भाई। पुणे, पटना, चेन्नई, मथुरा या फिर बेगूसराय, या फिर बेगूसराय। नए घर के लिए चाहिए 4K टीवी हाई फाई, या फिर वाइफ को चाहिए लेटेस्ट स्टाइल। EMI है ना, EMI है ना, मॉड्यूलर किचन में पुराना फ्रिज क्यों है भाई?
शादी है नहीं, मैट्रेस पुराना है भाई। अक्खा इंडिया बोले भाई प्राइजेस है हाई। बेस्ट ही खरीदना है तो अपने EMI स्टोर पर आए।
EMI है ना,
अब काशी हो या वाशी, महंगा लगे तो EMI और बेस्ट ही चाहिए तो भी EMI, क्योंकि बजाज फिनसर्व का EMI है ना। विजिट www.emistore.com।
EMI है ना, EMI है ना,
धोखा है धोखा, धोखा ना खाओ जी। इंश्योरेंस फ्रॉड से बचना है बहुत जरूरी जी। वो एजेंट है या फ्रॉड पता लगाओ जी। एक्स्ट्रा ऑफर के झांसे में कहीं फंस ना जाओ जी।
अगर कोई अनजान कॉलर इंश्योरेंस पॉलिसी डिटेल्स मांगे तो कह देना उनको।
मिलके स्कैम को एंड करो, हमेशा सेफ रहो जी।
Always verify the caller and do not surrender your insurance for attractive offers. हमेशा सावधान रहे, safe रहे. Issued in the interest of public awareness by Bajaj Finserv.
धोखा है धोखा, धोखा ना खाओ जी। जो होगा सो होगा ऐसे ना सोचो जी कॉल पे कोई पूछे ओटीपी दो ना जी
तो कह देना उनको
मिलके स्कैम को एंड करो हमेशा सेफ रहो जी
Being a hero is all about heart. It's not about ruling the world. It's about owning it. It's not about winning a race. It's about delivering a smile to the human race. It's about a spirit that just cannot be confined by geographies. It's about the heart that beats for the future and a soul that echoes the values of generations. And yet, being a hero is never about the hero. It's about the millions who celebrate them. Hero Motorcorp, the motorcycle leader. There's a gush of wind that hums a sweet song. There's a gush of wind that fights like a hero to fill the world with possibility. There's a gush of wind that jumps across oceans and mountains, embracing the entire planet. There's a gush of wind that blows away darkness. There's a gush of wind that blows for humanity. Because at Hero, we care.
In 1868, the Tata Group was founded on a philosophy that put the community at the heart of its existence. Today, we are $100 billion global enterprise. Our today has been built on enduring values. Is about delivering excellence across business sectors. Is about building a future-ready nation. Our today has a strong foundation with community at its core. today is dedicated to the communities we serve. Our today is always about more than just today. Our today is a continuous journey for a better tomorrow. Tata, leadership with trust.
Behold, the story of victory, of life over malady. Behold the saga of power, of science over sickness. Behold the tale of triumph, of dedication over disease. Behold the rise and rise of Cadila Pharmaceuticals Limited, one of India's largest privately held pharmaceutical companies based out of Ahmedabad, Gujarat, India. Cadila Pharmaceuticals was born out of the vision of a legend who left an indelible mark in the chronicles of Indian pharmaceuticals industry. He was Indravadan Ambalal Modi, the founder chairman of the company, rightfully christened as the medicine man of India. His vision to alleviate pain of the underprivileged through research-driven innovations has been driving Cadila Pharmaceuticals for more than 6 decades now. Innovations which are backed by the key strengths of the company, the state-of-the-art manufacturing and research facilities. The flagship manufacturing facility at Dholka, Gujarat, sprawls over 100 acres. This avant-garde facility is US FDA approved, besides meeting most of the stringent quality standards across the globe. It manufactures tablets, capsules, injectables, liquids, and orals. The second formulations manufacturing facility is located at Samba in the state of Jammu and Kashmir. The API facilities at Ankleshwar, Gujarat, manufacture a large number of key APIs and intermediates at this US FDA and ISO 9002 and ISO 14001 accredited plant. The company also has set up its first ever overseas formulation manufacturing facility at Addis Ababa in Ethiopia. This world-class facility is the only WHO CGMP compliant manufacturing facility in the region. More than 850 products spread across 12 specialties with many of India's top brands in its basket. Great goals are defined by far-sighted vision and achieved by seamless teamwork. A multicultural, multilingual and multinational workforce of over 7,000 employees is truly the propelling power of the company. Not just in the domestic market, the company has a wide global footprint with over 1,000 marketing authorizations across 85 countries. Its international sales force of over 150 highly diversified and versatile personnel lends it an outreach that blankets the globe. As the company grows, so does its commitment to research. Manned by more than 350 scientists, the R&D facilities of Cadila Pharmaceuticals at Dholka, Gujarat is an institution of breakthrough innovations. To take the focus on innovation to the next level, it partners with leading international companies to discover newer treatments. The Cadila Pharmaceuticals Group is gigantic. Its group companies complement and expand the dynamic vision of the company across new avenues of healthcare and newer fast-paced business areas. Cadila Pharmaceuticals is a gentle giant. Decades of dedicated research, groundbreaking healthcare innovations, and worldwide impact proves the infinite potential of one powerful emotion. Care. The success of Cadila Pharmaceuticals bears testimony to the fact that the care continues.
आने वाले कल की दस्तक हमें सुनाई देती है, नई मंजिल है जिस ओर हमें वो दिशा दिखाई देती है। नए इंडिया का नया जोश, नए इंडिया का नया जोश, नए जोश से निकल पड़े हम, आने वाला कल होगा हमारा। नए इंडिया का नया जोश।
और नए इंडिया के सफर में टेक्नोलॉजी की शक्ति लेकर आपका भागीदार रहेगा रिलायंस। नए इंडिया का नया जोश।
लाइफ में लेना देना तो चलता रहता है। इधर फ्लेक्सी लोन से बोरो कर लिया और उधर बाय मॉम डैड का वेकेशन डन। शादी का डिसीजन लिया, फ्लेक्सी लोन से और बोरो किया। प्रमोशन मिला तो ये लो थोड़ा लोन वापस कर दिया। थैंक यू। नए इंटीरियर्स का दिल किया, फ्लेक्सी लोन से फिर थोड़ा ले लिया। ईयर एंड बोनस मिला तो इस बार लोन ज्यादा वापस कर दिया। लाइफ में लेना देना चलता रहेगा तो लोन्स में क्यों नहीं। इसीलिए फ्लेक्सी लोन फ्रॉम बजाज फिनसर्व एक ऐसा लोन जो जब चाहे बोरो करे, जैसे चाहे रीपे करे, वो भी चुटकी में। थिंक इट डन विद बजाज फिनसर्व।
हेलो, हर सीजन के लिए नए इंटीरियर्स?
हाँ, वो भी हर रूम के लिए।
फ्रिज, स्मार्टफोन या बड़ा टीवी?
तीनों क्यों नहीं?
अरे ये तो शॉपिंग लिस्ट में नहीं था।
So, अब शॉपिंग कार्ट में तो है। सॉरी।
अच्छा, नए आउटफिट्स की विश लिस्ट।
विश क्यों? जस्ट ऐड टू कार्ट एंड बाय।
तो ये सब EMI पे?
और वो भी चुटकी में। On India's fastest growing EMI network. Think it, done with Bajaj FinServ.
सर, अपनों को खुश रखना इससे आसान हो ही नहीं सकता। साहब, अपनों को खुश रखना इससे आसान हो ही नहीं सकता। हुजूर, अपनों को खुश रखना इससे आसान हो ही नहीं सकता।
अपनों को खुश रखना इससे आसान।
अपनों को खुशियां दिलाना आसान नहीं बनाते तो आगे कैसे बढ़ते। इसीलिए हम जो भी करते हैं उसे बेहतर बनाते आ रहे हैं, बनाते रहेंगे। बजाज फिनसर्व, थिंक इट, डन।
माँ के बेडरूम का एसी या लेटेस्ट मोबाइल फॉर भाई, लेटेस्ट मोबाइल फॉर भाई, लेटेस्ट मोबाइल फॉर भाई। पुणे, पटना, चेन्नई, मथुरा या फिर बेगूसराय,
या फिर बेगूसराय।
नए घर के लिए चाहिए 4K टीवी हाई फाई, या फिर वाइफ को चाहिए लेटेस्ट स्टाइल। EMI है ना, EMI है ना, EMI।
मॉड्यूलर किचन में पुराना फ्रिज क्यों है भाई?
शादी है नहीं, मैट्रेस पुराना है भाई। अक्खा इंडिया बोले भाई प्राइजेस है हाई, बेस्ट ही खरीदना है तो अपने EMI स्टोर पर आए।
EMI है ना, EMI।
अब काशी हो या वाशी, महंगा लगे तो EMI और बेस्ट ही चाहिए तो भी EMI, क्योंकि बजाज फिनसर्व का EMI है ना। विजिट www.emistore.com।
EMI है ना, EMI है ना, EMI।
नाची 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 नाची। धोखा है धोखा, धोखा ना खाओ जी। नाची 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 नाची। इंश्योरेंस फ्रॉड से बचना है बहुत जरूरी जी। नाची 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 नाची। वो एजेंट है या फ्रॉड, पता लगाओ जी। एक्स्ट्रा ऑफर के झांसे में कहीं फंस ना जाओ जी।
अगर कोई अनजान कॉलर इंश्योरेंस पॉलिसी डिटेल्स मांगे तो कह देना उनको,
नाची 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 नाची। मिलके स्कैम को एंड करो, हमेशा सेफ रहो जी।
Always verify the caller and do not surrender your insurance for attractive offers. हमेशा सावधान रहे, safe रहे. Issued in the interest of public awareness by Bajaj FinServ.
नाची 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 नाची। धोखा है धोखा, धोखा ना खाओ जी। नाची 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 नाची। जो होगा सो होगा, ऐसे ना सोचो जी। नाची 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 नाची। कॉल पे कोई पूछे OTP दो ना जी,
तो कह देना उनको,
नाची 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 नाची। मिलके स्कैम को एंड करो, हमेशा सेफ रहो जी।
Being a hero is all about heart. It's not about ruling the world. It's about owning it. It's not about winning a race. It's about delivering a smile to the human race. It's about a spirit that just cannot be confined by geographies. It's about the heart that beats for the future and a soul that echoes the values of generations. And yet, being a hero is never about the hero. It's about the millions who celebrate them. protocol, the motorcycle leader. There's a gush of wind.
health tech sector are, and then the potential ahead.
Maybe we'll speak about it, Augustine, later. When I will, after this, maybe you and I can speak about some things on what we do.
Sure. Yeah, maybe in this venue, I also just want to have to explain to you a brief about our doctor, so in order to understand what are our doctor businesses are, yeah, at the moment.
Yeah, sure.
Yeah.
So should we go online, Sujata? It's 1:30 or
Yes, we are live now. I'm waiting for Ambassador to join, and I think Mr.
Okay. And what about we are also expected to get Dr. Sandeep, right?
Yes, we are just getting him in. I'll just
Okay.
check with my. Just give me a moment, please. So.
Hello, Ambassador.
Afternoon, good morning in India, and good afternoon, Selamat Siang. Selamat Siang, Indonesia.
Good afternoon, High Excellency of Ambassador Pak Manoj. Yeah, we call it Pak here, Pak.
Yes,
For
yes.
all the sir.
Jai
Is it
Bhut,
okay
Jai
with you?
Bhut, absolutely.
Yeah.
Good afternoon, sir. Sujata here. Sorry, my screen is a little frozen. I don't know why.
Okay, good afternoon to you.
Thank you, sir.
Hello, Sandeep. Good morning.
Hi, good morning. This is Dr. Sandeep Devan. Am I audible and visible?
Yes,
Yeah,
good morning.
absolutely,
Sandeep.
absolutely. Yeah, right.
Good morning from India.
Good morning. Good morning.
Hello, Dr. Sandeep. Nice to meet you. I'm Agustin from Allo Doctor.
Hello.
And I think His Excellency has also joined from the Indonesian Embassy.
Right.
So, sir, with your permission, may I start?
Yes, please, please, let's start.
Right. So just a moment, sorry. Good afternoon, everybody. My name is Sujata Sudarshan, and I represent the Confederation of Indian Industry, CII, in Jakarta, Indonesia. On behalf of CII, I'd like to extend a warm welcome to His Excellency Mr. Manoj Kumar Bharti, Honorable Ambassador of India to Indonesia, His Excellency Mr. Masni Eriza, Deputy Chief of Mission and Charge d'Affaires of Indonesia to India, Mr. Garish Ramachandran, President Asia Pacific, Tata Consultancy Services and members CII International Council, Mr. Newman Adhyarna, Acting Director for Digital Economy, Ministry of Communications and Information Technology, Government of Indonesia, Dr. Sandeep Devan, Director and HOD Fortis Memorial Research Institute of India, Ms. Augustine Gunawan, Vice President Partnership, Allo Doctor, Indonesia, and delegates to today's session on collaboration, opportunities for collaboration between India and Indonesia in digital economy and the future of digital services for healthcare. Today is the third day of the Partnership Summit. The summit is in its 27th edition and is being organized by the Confederation of Indian Industry in partnership with the Government of India. As digital economy happens to be one of the focus areas of countries across the world, especially after the pandemic, we decided to do a focus session on this, where we see a lot of opportunities for collaboration between our two countries. I would now like to invite Mr. Garish Ramachandran, President Asia. I'm so sorry, I think I didn't complete the whole. I'm extremely sorry. I think I didn't complete all the names.
Right.
Am I right, Girish? I'm so sorry.
Yeah, correct. I think I think you did mention. I don't think you mentioned Sandeep as well as Augustine.
Oh, I'm so sorry. So we also have Dr. Sandeep Devan, Director and HOD, Fortis Memorial Research Institute, and Ms. Augustine Gunawan, Vice President Partnership, Allo Doctor from Indonesia, participating in today's session. The session is being organized, as I already mentioned, on the third day of the Partnership Summit, which is in its 27th edition. I would now like to invite Mr. Garish Ramachandran, President Asia Pacific, Tata Consultancy Services, to give his opening remarks and moderate the session. Over to you, Mr. Ramachandran.
Thank you. Thank you, Sujata. First of all, Your Excellencies and my fellow panelists, a very good morning to everyone who has joined this session from different parts of the world. I would like to extend a very warm welcome for this year's Partnership Summit and to this very exclusive session on India-Indonesia opportunities for collaboration. I would also like to take this opportunity to extend my greetings and welcome all the speakers for the session today. The summit has received exceptional response from all the stakeholders. There are more than 200 speakers from 40 countries in over 50 sessions, including 7 country sessions spread over 3 days. We have with us Indian and overseas ministers, 25 global CEOs, and more than 150 heads of institutions and leaders and experts from around the world. As we are all aware, India and Indonesia have deep-rooted ties that spread over more than 2 millennia. And we have journeyed together through the centuries to emerge as modern-day economic powerhouses. As trillion-dollar economies, the two countries are poised to lead the world with their consistently high and impressive growth, which is backed by the demographic dividend and driven by a large middle class with rising levels of disposable income that has considerably widened the consumption base. Underlined by this bilateral relationship that is both comprehensive as well as strategic, the two countries have committed to take the two-way trade to 50 billion by 2025. The next 2 years is also very significant for both nations as they hold the G20 chair, both Indonesia in 2022 and India in 2023, and spearhead the post-pandemic global economic recovery through this opportunity to work together by creating mutual economic value and empowering our own citizens to provide an enabling and secure environment for growth. As India and Indonesia progress towards becoming the top 5 economies of the world, there is a huge opportunity for us to align with each other on specific sectors such as education, technology, healthcare, and both nations pretty much face challenges which are very similar, which is large populations that have low access to resources, and hence both solutions and learnings can actually be, we can put it together and learn from one another. Today, Indonesia is India's 9th largest trading partner and the 2nd largest trading partner in ASEAN, with a total bilateral trade of around 14 billion plus. And India is also a very interesting destination for most Indonesian companies and vice versa as well. With the pandemic significantly changing the global economic landscape, there are structural changes which are happening, and this is especially true of digitization as well as the digital economy. And in this context, enhancing cooperation and strengthening digital initiatives, especially in areas like digital skills, security, smart cities, blockchain, ICT, must be an integral part of what we call the India-Indonesia cooperation. And as we all are aware, Indonesia is very highly advanced in the startup ecosystem as well. So speeding up digital transformation can only speed up economic recovery, and the two sides must step up cooperation and connectivity on the digital front to build resilience while enhancing sustainable development and growth prospects. With growing economic interest, the two sides have a significant opportunity towards intensifying ties to realize the full potential of this bilateral partnership. With this, I would like to invite all the speakers to share their views. I would like to first give a small introduction about all the speakers first, and then I will invite all of them to come and speak one after another. First of all, we are very happy to have His Excellency Mr. Manoj K. Bharti, Ambassador of India to Indonesia. He assumed charge as the Ambassador of India to Indonesia on January 15th, 2021. He belongs to the 1988 batch of the IFS and served as Additional Secretary from 2018 to 2020. He is also held the position of Special Secretary Administration. He served as India's ambassador to Kiev as well as Belarus. And he has also served in the Ministry of Commerce, Government of India, where he handled economic relations and foreign trade issues with Central European countries. He served in multiple missions, including Tehran, The Hague, Kathmandu, Ankara, as well as Yangon. He has working knowledge of Persian, Russian, and Nepali languages. And second person who I would like to invite, introduce is His Excellency Mr. Masni Ariza, who is the Deputy Chief of Mission and Charge d'Affaires of the Embassy of the Republic of Indonesia. His Excellency was born in Padang, West Sumatra, and he joined the Ministry of Foreign Affairs in 1995 and is currently the Deputy Chief of Mission of Indonesian Embassy in New Delhi. He was previously Director of American and European intra-regional and inter-regional cooperation in charge of Indonesia's relations with regional organizations in America and Europe, such as the Mercosur, Pacific Alliance, CARICOM, European Union, and inter-regional platforms such as ASEAN. He was also Minister, Counselor, and Coordinator for Social Development, Rights of Vulnerable Groups, Humanitarian and Migration at the Permanent Mission of the Republic of Indonesia to the United Nations in New York. Mr. Ariza was also elected as the Vice Chair of the 71st session of the United Nations General Assembly during year 2016 to 2017. Thank you, sir. We also have Mr. Pa Nyoman Adhyarna, who is the Acting Director for Digital Economy for the Ministry of Communications and Information Technology. Dr. Newman currently works as the Acting Director as DG for ICT applications at the ministry, and throughout his career, he has worked in various fields of policy and regulation, including IT governance, e-commerce, and digital economy, digital startup initiatives, personal data protection, and domain names for supporting small and medium enterprises. Prior to his career at Aptica, he was also in charge of spectrum policy and planning for mobile services, telecommunications, as well as information technology, policy, and IT business development. Then we have two people from the private sector. We have Dr. Sandeep Dewan, who is the Director and Head of Department at the Fortis Memorial Research Institute in India. Dr. Sandeep did his post-graduation in anesthesia and intensive care medicine from PGIMS and fellowship in critical care medicine from Fortis Hospital in India. He's worked in various hospitals like Sir Ganga Ram Hospital. He joined Fortis Group in 2005 and has been instrumental in starting critical care medicine departments at Escorts Heart Institute and Fortis Memorial Gurgaon. He's got more than 15 years of experience in critical care medicine. He is currently Director of ECMO at FMRI and has been instrumental in establishing the FMRI Center of Excellence for ECMO. And then I have with me Ms. Agustine Gunavan, who is a Vice Partnership of Hello Doctor. And she graduated in finance and then majored in business administration in 2000 from Monash University. After that, she embarked her career into management in finance as corporate treasurer in AT&T. In year 2000, she enhanced further studies in Australia and took major degree in business administration. In 2001, she's been appointed by Roche as the supply chain manager and marketing divisions for about 16 years old. And most of the top roles in top management, business development, sales management, sales marketing, and PR. Thank you all for being part of this particular panel. May I now request Pa Nyoman to come and speak first and give your perspective. Pa.
Mr. Ramachandran, I believe Mr. Newman has got disconnected. He's trying to connect again. So maybe we can proceed with the next speaker.
Yeah, maybe then we just start off with Sandeep, Dr. Sandeep, if you can start off, Sandeep.
I will just give him a buzz. I think he's also on mute. So
Okay. Otherwise, why don't I ask Ms. Augustine to start off the session for us? Thank you, Ms. Augustine. Yeah.
Okay, thank you for such lovely opportunity. May I share my presentation? Okay, thank you to have Allo Doctor in this Partnership Summit 2021. It's really a great pleasure for me to introduce Allo Doctor in front of you, very outstanding gentlemen and ladies. So about Allo Doctor is actually we already in Indonesia for more than 5 years. So basically at the moment, we do have 36 million active users. And then in our community, we have around 50K doctors. So basically what Allo Doctor does in health tech, Allo Doctor is integrated medical journey. We are the only one health tech Indonesia that already certified by ISO 27001, meaning for data protection of the patient. So basically, most of our team are integrated medical journal in health tech, from readable content for the non-medical, and then we also running the telemedicine, teleconsultation. This is especially very beneficial for Indonesian user while we are in the pandemic session at the moment, so that people that don't want to come to the hospital for a consultation, they can do it with us. And then our platform are complying with all the medical doctor having the surat izin praktek or licensing to practice based on the medical offline facility of the healthcare. And then we do also, once if the telemedicine is not is already captured, but the patient still have to go to be treated in the hospital, we do have a booking concierge. So basically we already collaborating with more than 2,000 hospital provider and clinic provider across Indonesia. And then for every chat, we could do buying online pharmacy. We do have a pharmacy already, whether it is non-ethical or ethical product, as long as with the legalized doctor prescription, of course. We're not selling it for without prescriptions. And then we do have the protection, meaning the Allo Doctor insurance, our own product that could cover hospital cashback plan, as well as cover rawat inap or inpatient as well as outpatient with very affordable price. Our price ranging start from the 95,000 until 200,000 rupiah only per month only for the premium. So this is the philosophy of the journey. So we inform for the public as well. If they're asking for the doctor, we have a chat facility. We have a booking to refer patient to doctor and then to the hospital nearby. And then we do have insurance. And then we have shop, meaning for the pharmacy or non-pharmaceutical product. So basically, we are having more than 10K data bank of existing article. And then we are really reliable health information because all the article are being edited by our in-house doctor. So the doctor in our platform is only for editing, not for practicing, because we still align with the regulation. And then over the pandemic, we averaging manage over 750K consultation per month. So right now, the consultation not just about COVID. COVID is already decreasing, but right now more to non-COVID situation like psychology, and then related to the disease other than COVID problems. And then we have fully licensed GP and specialists on our panel. And then this is the booking. We manage more than 25K gross booking per month to our medical partner. And then this is the insurance product. So basically we have 30K new policyholder per month. And then this is just information about our product, Allo Shop. And then this is our total web traffic. So basically it's escalating period over period. And then unique visitors as well as total page view. So in terms of ranking, whether it is Alexa rank based on the word ranking for the tech company as well as similar web rank. So basically we are still leading on that area. And then this is our audience profile. Basically comprises more than 50% goes to the female, the rest is male. And then the traffic are from organic 85, and then direct 11, and then others is like from reference from other links, something like that, only 2%. So basically, this is the top 20 top article that people are seeking in our platform. And then about the chat or teleconsultation, mostly are from all the specialistic, it has been asked to our doctor panel. So besides that, we also being responsible, whether it is supported by the corporate that in contact with us or used to be or happen to be our client, do a CSR activity, mostly to open the central vaccine for the COVID-19. So this is like just a sample that one of the Ministry of Tourism, Bapak Sandiaga Uno, are opening our central vaccine, I think about last month. And then currently we do also, we're running in this December, we never stop running the central vaccine for kids because it's already eligible for kids under 12 years old. And then if I may assert what collaboration partnership that maybe could entice with Allo Doctor, we are looking for the distributor partnership for insurance product, basically for B2B and then B2C. And then we do manage or cater the offline and online marketing campaign as well as professional medical, be it webinar or conference. We are number one in conducting the online CMA with having SKPID from Indonesia. And then we also thinking about telemedicine package for segment specialist Indonesian market as well as corporate CSR targeted to Indonesia society. So this is just one of our services that for the product that very health conscious and then proven as medically to be effective in terms of medical as well as approved by the doctor. So we also have product like Allo Doctor Choice, that branding that this product is very health and safe to be used by the end user. And then this is just a glance of our conference, be it webinar, be it offline webinar conference that we have been conducted before. And then this is most of our major client. You can see that is most of the very well-known group medical partner. And then this is just all of the client that we have been in partner with us. In recap, I will say that why Allo Doctor is leading in terms of health tech industry Indonesia, because you could see that total population Indonesia is comprised around 260 million. Right now, the latest survey is 270 million, so it's only different 10 million. And then total internet user at the moment is 171 million, but this one will be capturing more by all the program that our Kominfo ministry like more boosting to more like better infrastructure. So in order for more Indonesian access to the internet is more reachable around Indonesia, across Indonesia. So basically around the current population 171, we already have 36 regular people access Allodoter per month. I think this is about Allodoter. I'm thanking you all for your attention, and then supposed to be any question, please do not hesitate to address to me. Thank you very much.
Thank you. Thank you. It was very, very enlightening, that whole presentation. Thank you very much. Okay. Can I now go to the next Pa Nyoman? I heard that you've come back. Can you get in and can you give your speech?
Thank you, Mr. Ramachandran. Yes, very, very clear. Yeah, I have problem to enter again this this conference. Now I can start my presentation.
Yeah.
Thank you, my distinguished President Asia Pacific Tata Consultancy, Mr. Ramachandran, all distinguished speakers, Ibu Agustin, my colleague from Indonesia, all the participants from this webinar or this conference. Good afternoon and good morning, India, I think. And allow me to start my presentation. Actually, the health sector is very one of the most important sector in Indonesia, and we would like to accelerate the transformation. Of course, the big issue maybe Agustin already mentioned, maybe infrastructure is a big issue in Indonesia, maybe like in other developing country, but we work hard to improve our infrastructure. We work together also with Indonesian health tech startup, to improve, to accelerate also the use of the application, to improve the service of people in the whole archipelago. Let me start with my presentation. Can I have my presentation? Or I share my own? Do you allow me? I share my own presentation? Okay.
Yes, Mr. Newman, you can share the presentation.
Sure. Thank you. This is my presentation.
Yeah.
Yes, this is the accelerating digital transformation in the health sector, a policy and regulation. Of course, this is a policy and regulation from the perspective of my ministry, because I think the Ministry of Health in Indonesia also have their own policy how to accelerate the digital transformation. We work together, of course, but there's a big challenge actually, because the priority is different between my ministry and Ministry of Health. And let me start with the growth of digital technology in Southeast Asia. Actually, this is not quite recently, the data 2020, but in the Southeast Asia, very huge, the market for the e-commerce. Gross merchandise value will be triple in the next 4 years, 5 years from 2019. And in this report, one thing they mention is the bright future of the health tech sectors and education sectors. But unfortunately, until the 2021, there is no report in these sectors. But Indonesia and Vietnam now, currently Indonesia and Philippines are the driver for the growth in the Southeast Asia for the digital economy. And this is the development of the health tech service in Asia Pacific. Unfortunately, I got the not quite new data, not quite recently, 2018, but Indonesia growth is quite good, 5%, growth of health tech service. But India is 32%, I don't know, it's very huge, maybe because India has very big pharmaceutical industry, medical equipment industry, but still Indonesia is still there is a big progress in this area. In terms of the investment, also China, India, Japan is still in the top list. And medical data analytics, health service search, medical diagnosis still the dominant in the last few years. And this is just for the information that Indonesia healthcare spending will be double from 2017 to 20 in the next 10 years. although it's not quite big, but knowing that the population of Indonesia, 273 million population, it is a huge number. And I think Ibu Agustin already just mentioned, and there are so many health tech startups in Indonesia. We expect we have another unicorn in this sector, and I think there are many candidates in this startup sectors. There are many. They are normally working in the information system, on-demand healthcare, teleconsultation. I think the dominant now is the teleconsultation. We have Hello Doctor, and many other things. Then we have AI, IoT, genetic, and others, but not quite dominant. E-learning also, and online marketplace, of course. And what is the focus of my ministry in the next 4 years? Let's say in the next 3 years, we will focusing more on the building and developing the IT infrastructure. We also have to encourage transformation, digital transformation, particularly in economic and the government sectors. And there are many program deliverables. Yeah, it is mainly in the infrastructure. Actually, in the Indonesian public, Kominfo, my Ministry of Communication and Informatics, much more perceive as the strong perception in the public on the infrastructure development. And the second one is about the taking down, blocking the negative content. There are two dominant perception in the people, but for how to accelerate, how to transform the people, the government, the economy digitally, that is still a big challenge. And the direction of the president, the dominant, the priority, of course, infrastructure and the roadmap for digital transformation. This is mentioned by the president in the early of pandemic 2020. And this is the three, there are 4 pillars of digital transformation. Basically, there are 3 objectives, actually: how to transform the economy, how to transform the government, how to transform the society. And we have to focus on these three of things. And as the foundation of this is the infrastructure. For digital society, let's say that we have huge project, massive project on the digital literacy. And this year we have to improve literacy of the digital literacy of the society with a target of 12.5 million Indonesian people to be elevated through the facilitation, training, etc. It's a huge number. In terms of the sector, for the priority for transformation, we already selected education, tourism, health sector, agriculture, maritime, and logistics. Why we choose this in my ministry? Because we consider all these 6 sectors are, if we successfully digitize this sector, it will create a huge impact to the society, because majority of people in Indonesia live in the agriculture, in the fishery, yeah? And also there are one sector very important like tourism. So it is important to focus in this area, and also health and education. For the health sector, we work with the startup to improve the health facility in the rural, let's say in the rural, in the village, yeah, through the digitalization. Then broadband infrastructure. I don't want to elaborate more. Very important for Indonesia to improve the broadband infrastructure, as we are an archipelago, and people live in very wide, very diverse location, and and currently it is a big challenge for us. So we have to finish the backbone infrastructure and then access it. There are 1,600 locations. This is particularly for the area we call as the triple T. Yeah? It is very remote, very in the border of the country and underdeveloped. Then we also will launch a satellite, high throughput satellite to connect with the very remote area where there is no whereas there is no what is called is there is connection. There is no connection in this area. Terrestrial connection on this area. Then this is just the new we just recently finalized the infrastructure in the east part of Indonesia. We hope that this will improve the broadband connectivity in the east part of Indonesia, which is very remote. Then this is just the overview of the majority of Indonesia. Actually, we have a 4G coverage.
We have another 2 more minutes, Mr.
Oh, okay.
Yeah.
2 more. Okay. This is the infrastructure. 4G is dominant, but actually there is still blank spot in Indonesia. Then we have the digital talent development also, as I mentioned, after digital literacy, and then there is a intermediate digital skill that we want to improve the people who just graduate, just start to enter the workplace. So we have to improve their skill to ready to enter the industry 4.0 era. I will skip the regulation. We can talk more about because we are still working to finalize the personal data protection regulation, and we have to improve also the regulation also in the electronic system provider. We call as the electronic system provider. Then and challenge the opportunity health sector is high disparity in health service, disparity of number of the healthcare professional. I think to Augustine well. Low quality health data, delay in data transmission, it is related with infrastructure. So by using the technology, we hope we can improve, we can solve many medical issue. Like let's say using application telehealth, remote surgery, using transfer large file with the 5G, let's say infrastructure, real-time monitoring system, and continual treatment. So this is the future surface for digital transformation in Indonesia. Then this is, I will not explain, already explain about my ministry. Basically, we work together with digital startup to improve the health facility in the rural areas. Yes, this is the scope of our program, Clinic Public Healthcare Center. We want to improve the public health, financing, clinic information system, online referral system, and public health data using the application and of course the IoT in the same area. And what we are doing actually, we are conducting the education training, health facility digitalization, working together with a startup, and we conducting also workshop and mentoring. I think that's all the presentation. What is the initiative from my ministry? Thank you very much.
Thank you, Pa Nyoman. Thank you. Now, let me go to the next speaker, who is Dr. Sandeep Dewan. Dr. Sandeep.
Hi, good morning. Am I audible?
Yes.
Okay. Thanks, Garish, and thanks, CII, for the opportunity to speak on this August forum. As I've already been introduced, I'm a practicing doctor. I'm a critical care physician. And I'm sure most of you have got used to the fact of ICU thanks to the pandemic, because now we have seen that during the last 2 years, most of the deaths in the pandemic in COVID obviously happened in the critical care units. And we have heard news of shortage of people, shortage of staff, shortage of infrastructure, shortage of ICU beds all across the world. Forget India, Indonesia, even established healthcare networks like US had struggled to maintain and the beds, and also struggle with the onslaught of the disease. I was very impressed with the talks by Mr. Nyoman, when particularly the last 2 slides, because that is the field where my area of interests have been. We know India is a large country, and healthcare is very, very, I would say, skewed as far as the delivery is concerned, because there are metro cities where the healthcare delivery is extremely good, like the state capitals, but there are always far-flung areas of the country where the healthcare delivery, particularly the emergency management, suffers a lot. And this has been the scenario all across the world. Even in US, even in Europe, the areas which are snowbound, the areas which are in the far flung, there is very acute shortage of specialist doctors in the farther parts of the country. Now in India and all across the world, this is the space, this is the area where expertise is clearly needed, and healthcare digitalization can become a great enabler in managing the clinical situations there. So as a critical care physician, my journey started in tele-ICU space 10 years back, when we were confronted with a 4-year-old kid which was actually operated for heart surgery and could not get off the ventilator. We started our telemedicine journey, and then with few rounds, we could get the kid out of the ventilator. That was 11 years back, and he's now become a young adult and he comes for follow-ups. So you always feel good that you have made some difference in somebody's life, particularly when the healthcare was not accessible. So what we do, we are a team of critical care physicians. In India and all across the world, the critical care physicians are in acute shortage. The reasons being that the average lifespan of people is going up. We are living with more comorbidities. We are living with more heart diseases, more diabetes. We have a lot of trauma as the roads have become very fast. But unfortunately, emergency care at the doorstep, at the far-flung area, is not available. And the golden hour rule applies in medicine, that if we can do certain things in the first few hours, it can make a lot of difference between life and death. So what we have been using is utilizing digitization and healthcare IT network to give support, emergency care support, to far-flung areas of the country. Our tele-ICU network, we call it tele-ICU, and it's not a new term. It's been there in medical fraternity for last 20 years. Through this, we actually give emergency care to villages, to district hospitals, to health centers, primary clinics. See, we all have heard about telemedicine, which is a very niche part where it's an elective job. But in an emergency, you have to give 24/7 care. So we have a command center here in Delhi, where a team of critical care physicians is always available. Critical care nurses are available. We connect that remote ICU or an emergency to our command center, and 24/7 access of the data is reaching to us, and we are able to monitor these patients. See, we have to understand, we will not be able to shift all patients to larger cities, and the time frame is very less in an emergency. And it is also proven that there are more deaths in ambulance rather than during shifting, because the ambulances don't have that kind of an expertise care. So because there's acute shortage of specialists, healthcare technology can be a great enabler that the specialist reaches the patients. And in 2020, when the pandemic hit the country, particularly all across the world, India was badly hit by wave 1 and also wave 2 in April, May, which was terrible. I'm sure you all have known about it. We worked very closely with CII and the government of India, and we established the largest tele-ICU network in the world of 669 ICU beds. And we have managed 21,000 critical patients in last 2 years. And out of this, only 762 have died. Imagine, these are the remote areas of the country, smaller hospitals where the government had worked extensively to build up ICUs in a fast pace. See, we did not get time to create intensive care because it takes time to create. But in a short span of time, the governments introduced the ventilators, the monitors, and an area which was fast converted into an ICU. But unfortunately, you cannot train people in 15 days. You cannot get trained manpower of nurses and doctors in a month. So we created that network closely with the government of India, and it's still functional. As I told you, only 762 deaths. And when we compared this pre-tele-ICU data with post, It is documented and we have represented it in medical journals. We have documented more than 50% survival can be done if a critical care physician is involved in the care at the remote site. See, we have to understand our specialists will never reach the remote areas. It is not possible because we are anyway having a shortage of doctors in India, and I'm sure it's the story everywhere. So why will a doctor go to a village or a district, smaller district? But if I can sit in Delhi and manage a patient in a remote area, I'm extremely happy to do it. Looking at it also brings a social change, and this is my expertise. So what we do is that through telemedicine, through tele-ICU, we give emergency care 24/7. The second very important piece, and Mr. Naim had also mentioned it, is about training of people. See, a specialist can advise, but you still need ground people to carry out the advice, isn't it? So when we realized it 5 years before, we started our own digital trainings in emergency medicine, because we still need junior doctors and junior nurses to carry out the advice given by the specialist. They need to understand what the specialist is saying. So the digital trainings have come a long way. Till now, we have trained about 5,000 doctors, and these are all pure MBBS. They are not graduate. They are not postgraduates. They are only graduate doctors and nurses. We have trained them in critical care, and they are our now pillars of strength. They know how to manage basic emergencies. See, what is the problem? When I started out my journey after MBBS, let me tell you, I knew nothing about how to manage an emergency, because I was all trained in theory in 5 years. I had not even seen a single patient. So how do I expect the next generation to start managing ICU patients after MBBS? Your expectation is wrong. But if we skill them, if we upgrade them, and we utilize them with our oversee, we can actually make a very big change in the emergency care. So this can go to trauma, this can decrease the maternal mortality ratios, it can go to pediatric ICUs, it can go to cardiac, it can go to stroke, obviously pandemic, although because I still feel the world has started viewing ICU from the pandemic perspective, but pandemic will still go, but our other diseases will stay. So again, I'm thankful to the CII and Mr. Garish for giving me the opportunity, but I think the era has come where the specialist doctors have to reach at the remote site, and emergency management is something which is struggling in the interiors of the country. If we can handle those situations, we can make a lot of difference between life and death. Thank you very much, sir.
Thank you, Sandeep. We now go on to His Excellency Mr. Masni Ariza. Sir.
Thank you very much, Girish. His Excellency Shri Manoj Kumar Bharti, Ambassador of India to Indonesia. Mr. Garish Ramachandran, President of the Consultancy Services Asia Pacific. Bapak Inyoman Adiarna, Director of Digital Economy of the Ministry of Communications and Information Technology, Indonesia. Ibu Agustin Gunawan, Vice President for Partnership, Alo Dokter Indonesia. Dr. Sandeep Dewan, Director of Fortis Memorial Research University, India. Distinguished participants, ladies and gentlemen. It is an honor and privilege for me as Deputy Chief of Mission and Shahid Affairs of the Indonesian Embassy in New Delhi to be with you today at this important session of Indonesia on India opportunities for collaboration in digital economy and the future of health services. I would like to thank the Confederation of Indian Industry for inviting and partnering with us in arranging this session as part of the CII Partnership Summit 2021. Excellency, ladies and gentlemen, I'm sure we all agree that digital economy have emerged as a growth driver for the post-pandemic economic recovery. Every business is now a digital business, and digital transformation initiative will be central to scaling up in the years ahead. Apart from a few sectors, pandemic has been a blessing in disguise and has only accelerated the shift from offline to online. In these times, for a business, having an online presence is not just an additional channel to market, but a necessity to survive. Like India, Indonesia has a vibrant digital economy driven by an increase in the accessibility and affordability of smartphones and high-speed internet connectivity. There are 170 million internet users in Indonesia, that is around 64.8% of the total population, with most using mobile phones to access the internet. Indonesia's technologically engaged youth population provides a large customer base for digital businesses. There are over 110 million Indonesians under 25 years old, accounting for more than 40% of the total population. Young Indonesians are more likely to be internet users, with internet penetration of 91% of 15 to 19 years old and 88.5% of 20 to 24 years old. The rise of e-commerce, digital streaming, online education, and health services digitalization have shown how digital economy can be an engine of growth during an unforeseen economic disruptions. In terms of healthcare, the digitalization in healthcare services has been declared by the World Health Organization since 2005 as a strategy to promote more equitable, affordable, and universal access to healthcare. Since then, we noted that more than 120 countries have developed policies to support the development of digital healthcare. Overall, digital health services help empower patients to take control of their own health, while also supporting health professionals and institutions to be more effective and efficient. We are very much living in innovational times for medicines, and the credit goes to evolving technologies. New technologies and approaches are ready to shape the pharmaceutical landscape in the days ahead. Wearables, sensors, health trackers empower both patients and the health conscious, enabling them to take better care of their health through technology. With telemedicine and e-pharmacy fast emerging as the new normal in India and Indonesia, as well as globally, digital healthcare innovations have come to redefine our healthcare ecosystem. The COVID-19 pandemic further underscores the need for digital health services in Indonesia. Initiatives were made by the Indonesian government to foster the use of telemedicine amid the pandemic in order to relieve the pressure on hospitals. The trend towards the digitalization of healthcare was further accelerated by the increase in digital transformation caused by the pandemic. Excellency, ladies and gentlemen, in the last 4 or 5 years, a range of digital health companies and digital health solutions have emerged in Indonesia. The large and geographically distributed population of Indonesia provides a strong user base for the country's developing digital health applications, while Indonesia's technologically engaged youth population provides a large customer base for digital businesses. AloDokter is an example of Indonesia's major player in online healthcare platform, providing a wide array of services ranging from doctor booking, insurance services, to digital healthcare content. Indonesia's digital health ecosystem is rapidly growing, providing business opportunities for India, as well as new areas for partnership and collaboration. At a growth rate of over 60%, digital health revenue in Indonesia are expected to reach $973 million by 2023. Excellency, ladies and gentlemen, bilaterally, India and Indonesia signed an MOU on bilateral health cooperation during the visit of Prime Minister Narendra Modi to Jakarta in 2018, aimed at strengthening collaboration in research and development, active pharmaceutical ingredients, and IT-based medical equipment. As a follow-up to the MOU, the first joint working group on health meeting was held in New Delhi on February 28, 2019, where Indonesia submitted a draft plan of action for the implementation of the MOU, which includes research and development in the health sector, human resource development, and share of experiences and best practices. Excellency, ladies and gentlemen, as highlighted during this session, there are vast opportunities for collaboration between Indonesia and India in digital economy and health services digitalization. To conclude, let me extend my highest appreciation to moderator, Mr. Garish Ramachandran, and all the speakers, not only for your presence and presentation in this event, but above all, your contribution to take this collaboration forward. The Embassy of Indonesia in New Delhi stands ready to cooperate with the CII to facilitate the business community in sorting out issues, eliminating impediments, and communicating with both governments. I thank you.
Thank you, Your Excellency. May I now ask His Excellency Mr. Manoj Bharti to address all of us.
Good afternoon, all the participants. I believe it's almost noon time in India as well. Let me first acknowledge Excellency Mr. Masni Eriza, Deputy Chief of Mission and Charge d'Affaires of the Embassy of the Republic of Indonesia in New Delhi. I hope you have settled down well, Pa. It's nice to remember your meeting, our meeting, few days before your departure, and I wish you all the best while you take over charge. India is a vast opportunity for a diplomat, and I wish you all the best. I would also like to acknowledge the presentations made by Mr. Neoman Adhiana. It was a wonderful presentation, and I have picked up a lot of things from the information provided by you. It is actually a benefit. In hindsight, it is a benefit to speak last, because then I can avoid repeating many things that has already been said by the other speakers. I would also like to thank Mr. Garish Ramachandran for your moderating this session. And of course, Ibu Augustine Gunawan, Vice President of Hello Doctor. Thank you very much for your presentation. Dr. Sandeep Devan from Fortis Memorial Research Institute. It was a wonderful presentation to know about the last minute emergency cases and how telemedicine or emergency can help in such situations. Distinguished ladies, gentlemen, guests, I see there are 925 live on CII Hive. I would like to express my thanks to CII for organizing this partnership summit. And I am also amazed that you have chosen a very relevant area, digital economy and the future of health service, for this kind of intense deliberation and interaction. CII should also be congratulated to organize this participation summit under the chairmanship of the Honorable Minister of Commerce and Industry, Consumer Affairs, Food and Public Distribution and Textile, Mr. Piyush Goyal. I would like to recall what I just picked up about 10 days ago when I was there in Bali for the International Health Business Summit. And the presentation made by Ministry of Health during that Minister for Health during that event matches very, very closely with what I have just seen presented by Pa Newman, which is from Ministry of Information. He said that both of you are working in two different units and directions, but even then I saw a lot of similarity on the way forward for Indonesia in the digital health, digital economy and health services. This also matches very closely with Indonesia's stated direction for the G20 presidency that they have got for the year 2022, with a motto called Recover Together and Recover Stronger. In the presentation in Bali, I noticed that government of Indonesia has emphasis on three pillars under this motive and under this improvisation of health system in pre and post-COVID environment. And these are building global health system resilience, harmonizing global health protocol standards, and expanding global manufacture hubs to lower and middle income group countries, and knowledge sharing for pandemic prevention, preparedness, and response. When we go to the details, they cover a lot of things which we have just discussed here. And that was reflected in Pa Newman's presentation as well. I would like to mention here that India is in an ideal situation to work with Indonesia, government of Indonesia, both in the public sector as well as in the government SOEs sector, in bringing out these elements to the fore and providing the best possible alternative for joining hands. And I'll give you an example. There was a lot of emphasis on skill development in the health sector. I'm sure Pa Newman knows that India provides a ready-made solution for intensive training modules to be provided under what we call the ITech training scholarships. India provides a huge number of scholarships under what we call ITech program, and the details are available on our website. I request the Ministry of Health and Ministry of Information in Indonesia to go through the website, ask somebody to go through the website and inform people who require training. We are very glad to provide as many online training programs as you would require, because offline, that is going to India and getting the program, has some limitations about costs of taking people around and lodging and boarding. But with online programs, there are immense possibilities, and numbers that we can handle are pretty large. And we would like to provide you with this facility for training of manpower at your disposal. Similarly, I would also like to correct one figure which was presented earlier by Mr. Garish with the latest trade figures. The latest trade figures provided by the government of Indonesia, Statistics Department, is for January to October 2021. According to this statistics, bilateral trade has already reached about $17.1 billion between India and Indonesia, which is about 30-35% improvement on last year's trade figures. It is also to be noted that during this period of January to October, the trade deficit that India faces vis-a-vis Indonesia is about $4.65 billion. That means while Indonesia's export to India was nearly $10.7 billion, India's export to Indonesia was $6.15 billion. These figures are clear indication that both our countries are getting out of the pandemic hit economic state. We are ready to do business, and we are willing to increase our trade to meet the target that has been set for us by our leaders to reach $50 billion by 2025. I have no doubt if we intensely work in the area of health services and digital economy, sometimes combining both of these, we have ample opportunity to reach this target. I would also like to take this opportunity to inform all our viewers that Indian Embassy has brought out a recent publication which is called Kasamaan, which in Bahasa Indonesia means similarities, between India and Indonesia, and the title is The Next Step. 4 years ago, we had brought out a book called Kasamaan, India, Indonesia Still in Steps, in which we discussed about past similarities between India and Indonesia. But this book focuses on our present and future endeavors, and it concentrates on 19 different sectors of cooperation which can be done between India and Indonesia. And you will be surprised to know that the three sectors that we are dealing with, digital economy, health sector, and the combination of both these, have been discussed in this book in details. And I would strongly recommend people to go through this book. This is also available on the internet website, to learn as to what steps can be taken and how we can improve further. Lastly, I would like to take this opportunity to say that we have talked a lot in terms of theoretical information. I am very glad that we have two practicing people from the public sector who are also part of this seminar. I would strongly recommend the public and private sector, both in India and Indonesia, to now come forward in active participation rather than just our talking on internet or offline or online mode. Please notice that as my colleague Masni Eriza has already said, Indian Embassy and Indonesian Embassy, Indian Embassy in Jakarta and Indonesian Embassy in New Delhi, are fully prepared and very, very keen to bring the two sides together in terms of actual business. We would love our people to come up with solutions, seek out what can be done in each other's country, look for partnerships, look for policy changes, policy information, so that we can get into the job of doing things on the ground. We have had enough of talks. Pandemic is almost over. We can do a lot of business online. We can also travel now if we are required to travel and meet people, see the ground realities. I will strongly recommend that with a population of $1.6 billion in both India and Indonesia together, which forms nearly 1/5 of the entire global population, we have enough number of opportunities to deal with the health sector, use digital technology to modernize the health sector, and join hands in making things possible. I would not like to take any more time and thank the organizers very much for giving us this opportunity. Once again, with this appeal that let us do something on the ground, I thank all of you.
Thank you, Ambassador. Thank you, everybody, for your wonderful insights. I will probably take a minute to summarize because I don't think there is time for us to discuss. As I always believe that before the pandemic, there was technology in every business. But now, what the pandemic has taught us is that every business has become a technology business. So, and what we have also seen is that if there is a strong vision put together by both the governments of reaching 50 billion by 2025, and we have both the embassies here and the ambassador, Ambassador His Excellency Manoj Bharti, as well as the Indonesian side, we had His Excellency Masni Eriza also very clearly articulated how both the embassies stand together to ensure that the private sector is enabled through this particular and how industry facilitation can be done by both the embassies. So I strongly urge the private sector to see how we are able to utilize this opportunity and scale up the significance of business to reach the 50 billion. The year 2022 and 2023 belongs to India and Indonesia. We will be in the thick of everything, right from the presidency of the G20. This is the opportunity, and let us ensure that we don't waste the 2 years, but we accelerate towards digitization and ensure that we reach the 50 billion mark by 2025. Thank you very much for this wonderful session. I want to thank all of you for contributing towards this and would like to pass it back to Sujata. Sujata.
Thank you so much, Mr. Ramachandran. This was indeed a very insightful session and very timely also, I think. I would like to thank His Excellency Mr. Manoj Kumar Bharti and also His Excellency Mr. Masni Eriza for joining us today and giving us their valuable insights and advice. I would look forward that the private sector, especially from both the countries, get together to collaborate I'm based here in Jakarta, and I would be happy to answer any queries and facilitate connects with the private sector back in India. And I thank you all once again for joining us. I would also like to thank Dr. Devan for giving us such valuable information, and look forward to working with all of you together to take this to a different level. Thank you so much.
Thank you.
Thank you.
Thank you very much, everyone. Ambassador.
Thank you, everybody. Thank you very much.
Thank you, sir.